welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart. I'm the stroke nurse navigator for Norton Healthcare in Louisville, Kentucky. Today, my guest is Dorothy Henning. She is one of our instructors here at the Norton Neuroscience Institute Resource Center. She teaches the Feldenkrais Method in a special class for our patients. So, Dorothy, thank you so much for being with me today.
Thanks. I'm happy to be here, Rosa.
So, I said a big word, Feldenkrais.
Yes.
Now, what in the world does that mean?
Okay, the word comes from the name of the man who created the method. And he's a doctor, and he was born in 1904. And he died in 1984. And during that period of time, due to even his own injuries and his other research, he discovered how movement was linked neurologically with us in such a way to help us improve.
And that's pretty life-changing, because a lot of people think that once you have some kind of neurological injury, whether it's your brain cells or other nerves, that those nerves are dead and they're gone and there's nothing else to be done about it. But we've learned that there's this thing called neuroplasticity.
Yes.
And that is exactly your field of expertise, is tapping into that neuroplasticity. So what is the Feldenkrais method that he developed?
Well, since it's based on the premise of neuroplasticity, which is the brain's capacity to change and learn at any age and under any conditions, which earlier was not known, and through research has become more and more to be discovered and confirmed that indeed it is true. So with this method, and I know it can be hard to say the word Feldenkrais, sometimes I'll say, well, it rhymes with paradise, and then we'll know Feldenkrais, paradise, just to help with how to say it. So with this method, it's not prescriptive or with outside criteria of fixed things you're supposed to do. Rather than that, it's a sensory-based learning.
So it's not like something where you get a printout of a list of, here are these 10 exercises, do these movements in this order, and you'll have this result.
Exactly. It's not like that. We will do movement, and some things could seem familiar to exercises you've learned, but these are actually not really exercises. They're lessons, because as you're doing the movement and the way I'm guiding you and guiding your attention, that's how these neurological changes take place, and that's how you learn.
That is so... Okay.
It's fascinating, isn't it?
It's fascinating. Yeah. It's so exciting. I have been enamored with the idea of neuroplasticity and the idea that we can direct our attention toward our nerves and tell them to do something that we previously believed to be impossible.
Exactly.
But to teach them to learn to do something new. So, when you are teaching Feldenkrais, I think a lot of people who are experiencing nerve pain or something like that, or have been through a lot of physical therapy, might be concerned that it's strenuous. So would you say Feldenkrais is a strenuous exercise?
No, and I'm really glad you brought that up. I think that slow movement is the new fast. It's the new way for us to learn. It's like the newest idea, because through slow movement, you quiet the noise in your brain. You could even think of it similarly to if you were in a crowded room and everyone was talking and you were trying to talk to one person and it was hard to hear them because there was so much noise. It's the same way when you do movement really hard and fast. It's so much noise for your brain, which is the term that's used, the neurological term. But it literally is like noise. And then it can't hear like, oh, what am I sensing? What am I feeling as I'm doing this? And I may ask you those questions, but if it's really done hard and fast, you won't notice. So it's very gentle, to address the concern here in that question. It's very gentle and easy movement. And it's in this way that we learn, because it's pleasurable and it feels good. And that I always find to be interesting for everyone, is amazed when they ask me, how do I know I'm doing a good movement, Dorothy? And I said, one way you'll know, it's the best criteria. It feels good.
So if it hurts, stop.
Exactly.
That's
and
not the goal.
Not at all. I will guide everyone in that. Not only do we not want to have pain, we don't even want to approach the idea of pain, because it's in the comfort zone. The safety zone is where the learning happens. Because if you go into where something feels forced or it hurts, then it's like there's a response inside you to contract and start to protect yourself. And then you're holding very tight, and there's really not any learning that can happen.
So how does it work?
Okay. So that's, well, as I was beginning, so by guiding you one movement after the other, they're sequential, and there's a reason they're done in this way. You're exploring and finding your way out of difficulty rather than someone saying, here's what you should do. But I'm guiding you through what you're sensing. So it's not like you're on your own. You might say, be moving an arm, and I'll say, and as you're moving your arm, I might draw your attention, because it's about guided attention. Do you feel something in the ribs? And you might say, like if you just lift your arm there now and you notice, do you feel a little movement in the ribs too?
I do.
You do, but you may not have noticed that before because your attention's on the arm that's moving.
Mm-hmm.
And so by drawing your attention to these other parts of you, it actually helps fill in the image you have in your motor cortex in your brain of what the movement is about and how you move your body, because that's how we move. We actually have an image in our brain, and we develop that from when we're babies. But the wonderful thing, back to neuroplasticity, is you can always help it, and it can change, and you can help it grow so that more is, because it's so wonderful that with our human intelligence, our wonderful brain, is that even when you do a movement and say, I guide your attention to notice your ribs as you move your arm, then later you do another movement, you've already learned it, and you'll integrate that. And you'll do that in the next movement. So that's how the changes take place until things seem easier.
So I think what you're describing is proprioception,
Mm-hmm.
right?
In part, yes.
Okay.
Yeah, and also interiorception.
Interoception.
Yeah, interoception, where you're feeling inside. And then also we'll sense that. One of the easiest ways to do it is with what you feel outside, because you're always a body or a person in an environment. So sometimes we'll talk about, how do you feel sitting on the chair? And you're like, how? What do you mean, how? Well, do you feel more weight on your right hip or more on your left hip? I'll ask you to compare things, because our brain loves to compare and it loves to discern. And that's how it learns. I like to call it the great discerner.
Yeah.
It learns that way. You remember as a kid, you would compare the cards, like which ones match and which ones don't match. That's what we're doing. But we're only doing it with our own movement, because we learn by comparing.
Yeah. And so as someone who works with a lot of people who've had strokes,
Yes.
they developed that initial proprioception and interoception when they were young, but then they've had a stroke and those parts of their brain may have been injured.
It's true.
And so they need to regrow those nerve connections that allow them to really understand their own body and be able to direct their own body like consciously or subconsciously, right?
Right. Absolutely. In fact, I also like to think of it as like, although neurons have their specialties, and they do, the wonderful thing about neuroplasticity is I feel like by doing this movement and with attention is that it's almost like a call to maybe some other neurons. And you feel like if you called them on the phone and you'd say, now this may not really be your original job, but would you consider it? And they said, okay, we might do that. So, and that call happens through the movement we're doing. And we might do it through a very gentle but small constraint. For example, maybe your right arm does so much better than your left because you could be more affected on the left, for an example. And so I might have you hold your right hand arm against your chest and then reach around with the left so that your attention will go to your left hand and your left arm because the right's not available. But we will quickly go to doing what works better. So it's really understandable. It takes what's at the basis of a lot of what I do, I have to say, is radical self-kindness. That's what I've termed it. is that as we do this, you're very kind to yourself, because there's a lot of grief involved with first losing some of this capacity. It's a hard time to go through. And I help people through that period to be able to then do more and move on. But it's not by forcing. It's very, very gentle and kind, because it's important to understand that, of course, you're going to go toward the arm that works better. That's what we do. And that should be expected. And it's going to be fine that you do. But there's still some connections that could actually happen, perhaps to another side, or something that you don't sense or feel as much since the stroke. And we just do a very gentle kind of encouragement or call there that happens in such a way that sometimes it surprises you. It's not done ever with force. So
that's what we've heard the most come out of your class is surprise, because people will come out of your class. I brought some of their quotes so that we can reflect on that. One of them said, "Today's class helped so much with my breathing." How did it help them breathe better, I wonder? Or, "I feel more stable, less wobbling. I noticed my left arm, which is more affected, feels more flexible." So that's what you were describing.
What I was describing.
And then my back was hurting, and this was so relaxing, it made me feel better. Well, that leads us into another question about pain. So if someone comes into the session to learn, but they're having pain, is that something that they can still do and participate in if they have chronic pain?
They can. And what I will do is guide you, I can say, guide you to move in such a way that doesn't trigger the pain or initiate it. I'll suggest to do the movement smaller, and you'll know these concepts as you learn them, and then you'll always apply them. If something feels like a little bit too much, you do it smaller. You can do it slower. You can repeat it less times. And then if really it's a place that you just can't move at all, then you do it in your imagination. And the imagination is so powerful, and also is our complete neurological process. We think of it as something different, but it actually is part of a process of moving. Only when we imagine a movement, we're just inhibiting actually doing the movement, but it's the same neurological order of firing, and it takes the same amount of time. So it takes the same amount of time to imagine walking across the room as it does to walk across the room.
So this is the kind of visualization that I believe athletes use,
absolutely,
in, like the Olympics, to prepare for a certain course or something like that. They'll be visualizing the course.
Exactly.
Not just, I'm going to picture it in my head for 2 seconds, but like step by step.
Step by step.
Taking the time to fully imagine being immersed in the experience, right?
And I've helped people with this. I've actually helped Olympic level athletes
in
order to improve. And sometimes they get to a plateau and they can't go further. And so it's not by more force. All of a sudden, we're doing the same thing we do in our classes that we do here at Norton. So I always say, whether you want to run a marathon, better, or get out of a chair, it doesn't matter. It's still the same ideas and the same concepts will apply. And also regarding pain, there could have been a period, if I could add this, where you've just had to do it no matter what, apply your will and your vitality. And this is commendable. Now, I never think that we should put down the solutions we've had up till now. We do the best we can. What we're looking for is more options with kindness. And so after a period of doing this, though, we find that, wow, we're not really advancing or improving with this. So by slowing down and backing off of that, then you're able to find maybe a new pathway, a new way. I had an example of someone the other day. For example, it was really hard for her to lift a foot because she couldn't make that command to the left foot in this case.
She couldn't will it to happen.
She couldn't will it to happen. And because she didn't outside of herself see a big movement, that can be hard. So I want to talk about the emotional aspect so that there can be where, if I can just kind of lift the hip or throw something and sort of work around it, you can maybe make something that looks like the foot moving, but it's really not making those same connections. And so I said, it's okay. We're going to slow down. And I want you to maybe you barely feel like the skin's still making contact, but you feel it barely pulling away. And she did that in those first moments, and especially if either you have chronic pain or you have another issue, and the movement is so small it either doesn't hurt or is possible, that first moment can be, wow, I can't believe that's all I can do. And so that can be hard. So to avoid that, sometimes we'll do something really hard, but I'm here to guide you and to teach you to be really kind to yourself and very gentle. So she did that. She said, wow, it's hard for me to believe that. That's why I'd rather throw a little bit from my hip and make it happen. So she did it just like that. She rested and we left it. And then she got up to walk and she could walk better. So see, it's not the size of the movement. That's irrelevant. And so that can be different because we're used to thinking we got to see something big happen. It's not the size. It's that you're kind to yourself, that you go gently, and that you help those connections happen. It's the connections that are going to be important.
That's a really fast connection for her to have that quick turnaround. And I know you see a lot of really fast responses like that. I think we had a quote from somebody who said, after the lesson, I could stand up and put on my coat so easily. I never can do that. But that's not always the case for people when they come to your class, right? Sometimes it takes multiple days, months.
It does. And when people are new, I'll often say, and I'll have others that have been there longer speak to them. And it's just wonderful to hear what they say, because they'll often say, now stick to it. I did. Don't expect something the first time. And that's really the best encouragement, because it really is about slow improvement. You'll see something, you will have these amazing moments, and then slowly things get better. It's kind of similar to, have you ever studied really hard for a test, like all weekend, and on Monday you just ace the test? Yeah. And then later it gets to be like Friday and someone talks about the same thing or the questions, and you're like, it's not as fresh in my memory, right? Mm-hmm. That idea. And so it could be like that and that's our fast, our short-term memory, mm-hmm. learning very quickly. And so the long term can take a little longer, and you'll notice differences, you'll feel them, and then you just kind of have to keep at it. And it's slowly growing. I had someone who wasn't sure. I could see they were getting better, but they were like a little doubting it. And they saw a friend they hadn't seen in 6 months that had a stroke. And they saw a friend they hadn't seen in 6 months. And they'd seen her before, when she was walking, they said, wow, you're walking better. And she said, am I? Because the changes that happen become such a part of you that you don't even think you were ever any different. It's not that you're trying to do something like from the outside of you, like forcing from the out, like I'm going to make myself do something. Instead, it becomes a part of you. You integrate it, is what we say. It's an integration. So as it becomes a part of you and you slowly make these differences, you may not even realize it. Because it's not such a big noticeable jump. You'll say, oh, I'm just still not as good as such and such, or as I was. And we have to let some of that go, because we don't walk backwards,
we don't want to compare ourselves to other people, because every single person is different.
Everyone is different, exactly. And it's not in the same way. It's not from the outside the learning happens. It's from the inside. And and people say over time, it's made such a difference. They'll notice maybe, I just don't hurt as much. I walk a little better. I can go longer than I did. Or I start to feel like I'm going to get in trouble, which means maybe usually is something like the arm starts hurting or the shoulder. That's what, whatever for them their trouble is. I feel it kind of starting, and it's like I just kind of know how to get out of it.
Oh, wow. Yeah. And just kind of like stop that in its tracks.
Yes.
Wow.
Yes.
Mm-hmm. So can you take a minute and just tell us how you learned the Feldenkrais method? Because I'd never heard of it before coming to work here.
Okay. Well, that's a little bit of my own story. I knew about it. I was a director in San Francisco at a large nonprofit. So I was hiring people that would hire other people to do, my supervisors, to do wonderful programs that help people. And I'd heard about this Feldenkrais. I said, well, let's try it. So I have to tell you, I tried it. It can be hard the first time, because I was like, I think it's pretty good. I'm not sure what just happened, but, I'll have to do that when I have more time, right? So time goes on, but I said, yes, let's hire them. This is good. So that went on. And a couple of years later, I get hurt. I have an old injury come back from my shoulder, and I'm doing too much computer, and I tried everything, which a lot of people that end up trying that will say this. I've tried everything.
Yeah.
I did the same. And then I went, what about that Feldenkrais I knew about? I had no idea, Rosa. I mean, it just turned my life around because of how I approached things. I didn't realize I was forcing. I didn't realize behind it, even sometimes how I would do something was like, or working extra long, was I have to show I'm good enough. And and I got more based on what I felt and what I needed, and learning in a way that let something change and grow on its own, that became a part of me. And I mean, I couldn't even pull the blankets up without so much pain. It was so bad. And I have to tell you, it took some time, but after a year, and then even 2 years later, I did a physiology of sports degree when I was I lived in Strasbourg, France. And I could do that. I didn't think I could ever do those swims that I had to do. If you asked me that before, I would say, no way. So the changes that can happen, and that was from studying Feldenkrais, I completely changed my focus. I mean, it was still in health and well-being, but I focused on Feldenkrais, a 4-year training program. I did 2 years in San Francisco, and then I moved to France, where I was saying, right? And so I finished my last 2 years there, and it was just a fascinating program to complete.
Well, thank you for bringing it to Louisville, Kentucky, of all places. And then you started your own business called Integrative Movement.
I did. And because I was born here, so I'm like a hometown girl who's, come back. And so after living in San Francisco and France, I've come back. And of course, I bring what I've studied, with me. So I opened my business here, and it's called Integrative Movement. So I teach group classes. I have an online membership. And as you know, I teach for Norton, which I just love. And
which is available to our patients for free to them. It's a community program. You can take a sample class every Wednesday.
Every Wednesday at 1 p.m. So I want to be sure that's known. In fact, when I meet new people and they're interested in this, I always ask, do you have a neurologist or a provider in Norton? Because you could take in the neurology, the Neuroscience Institute, then you can take this class for free. Because you never know. I mention it and they go, oh, I do.
Yeah.
So that's where I do that. And then I also see people individually. And that's with a very gentle hands-on touch that is not insistent or forced in any way. I'm really moving with you. And that also encourages and initiates the learning for improvement.
And so if somebody wants to find you for more individual coaching, they can do that through integrativemovement.us.
That's right. And I even have on my site, if you come on the first page where there's a little video, but this a little explanation. And there's also a free lesson that you'll see right there on the side. It just says, try a lesson here.
Yeah. So check out the show notes for a link to Dorothy's website, integrativemovement.us, as well as how you can sign up to be a part of her class here through the Norton Neuroscience Resource Center. We want to make these available to people all over who are not able to come in person. So that's why we've continued to offer these programs through Zoom.
Yes, I do it
Especially
online.
There's a lot of people who are struggling with these things. It's painful for them to go out to participate in classes, and never mind if they live out in a rural area and it's a long drive with expensive gas. So we are so glad that you're willing to share your wealth of knowledge virtually. That really has made a lot of difference for our patients, and I hope that more people will find out about it through this as well.
I hope so, because people have let me know I couldn't come if we didn't do this online. And so I'm so happy that we have this opportunity to offer it.
Yeah. Well, thank you so much for taking the time to be here today, Dorothy,
You're welcome.
and telling us all about the Feldenkrais Method. And you can find us in the next episode of the Stronger After Stroke podcast.
Thanks. It's been a pleasure.